sign in. As you just heard, this meeting is being recorded. Um, um, we will allow time for questions at the end of the presentation, but you can also put any questions or comments in the chat box. We'll be monitoring that as well. We'll go ahead and get started due to time. I don't want to take any extra time away from our presentation. So we are very thrilled to have Brooke Gill back with us this evening. And Brooke has spoken for us before last year. She works with the Alzheimer's Association in Central and Western Virginia chapters. And tonight she's going to be talking to us about balancing the foundations of caregiving. So we're really happy to have her with us. Just a little information about Brooke. Brooke Gill helps to build strong relationships with external stakeholders through team building and connecting communities to support and break down barriers to resources. She is a passionate individual with extensive experience in higher education, human services, and senior health. Her previous roles were at the United Way of Roanoke Valley and Ferrum College. I hope you all can hear me okay. I'm not going to be talking much longer. There is muffling in the background, and I apologize for that. Our heating system has a fan that blows constantly, so I'm sorry if I'm not coming through clear. I hope I am. But I'm going to turn things over to Brooke now, and you can listen, and like as I mentioned, we will allow time at the end for questions, and you can use the chat box. So thank you, Brooke. Take it away.
Absolutely. And if you know the chat box to the side, there's a little form that the association is asking you to fill out with just your name and your zip code. This tells us who we're reaching and where we are reaching them at, so that we can fill gaps in services if we see them on our little cool maps that we have that show us where we're reaching people. So if you don't mind just doing your name and your zip code there, I would greatly appreciate it for our records. And then let me scoot back over to my other screen here. There it is. Can everybody see this? PowerPoint says building foundations of caregiving.
Yeah. Yes.
Okay.
Yes.
Just want to make sure. All right. And there are some videos in this presentation. So I did share the sound, so hopefully it works. But if you cannot hear me, please interrupt me and let me know so that we can handle that and figure out what's going on. So as she said, I am Brooke Gill. I am the Senior Program Manager for Central and Western Virginia chapter of the Alzheimer's Association. It is a mouthful, but that means that I am covering about 52 counties in our chapter, including the Charlottesville area, which I think most of you are probably from. We have our home office for our chapter there based in Charlottesville. So we are always available for you guys if you need us. Today's presentation is part of our Empowered Caregivers series. So we just actually got our hands on this series in March, so it's still new for me, but I'm happy to share it with you because it's an exciting series of information for caregivers. We're going to start at the very beginning. It's always a very good place to start. And this is called Building Foundations of Caregiving. So in this presentation, we are going to talk about different ways to build that foundation, that support system around you as a caregiver. These are the other parts of our Empowered Caregiver program: supporting independence, communicating effectively, responding to dementia-related behaviors, and then exploring care and support services. All 5 of these are great series, and we're hopefully going to get them out and about into the community really soon. So today we're going to talk about what your role is as a caregiver. I say caregiver, sometimes I'll say care partner. It really just depends on how you want to be talked about. And as part of that, I will say make sure that people know what you want to be called as that care partner in any kind of situation. And that is important because it's the role that you have and you're the one doing it, so you should have a name for it. So we're going to talk about those relationship changes that may change between you and your person, whoever that person is. Sometimes it's a family member, sometimes it's mom, sometimes it's a sister or cousin. We don't know what care spaces we'll end up in. So we want to make sure that we understand how those different relationships can change. We're also going to talk about our 5 areas of person-centered care. We're just going to kind of touch on them. That is something we talk more in depth about in our dementia-related behavior program that we do. We're going to identify those possible members of caregiving support team. So who is your team that's surrounding you to help you through this journey? And then we're going to list some actions about how you, as the caregiver, can lower your stress. And that is super, super important. And I know some of you may already be in this space going, there's no possible way to lower my stress, but we're going to give you some ideas and we're going to try to help you through that as best as possible. So when we're talking about caregiving, we just talked about this. Who is a caregiver? It's anybody. It's any person. It's a family member. It's a friend. It can be a professional that is the person helping and spending their time with that person living with dementia. Most people who are care providers in the home, over 11 million unpaid, are not professionals and they do not have any formal training in this field, and many do not feel prepared. Some of you may be already there. And ultimately, when you get diagnosed, when the diagnosis comes down for both you and the person living with this disease, most of the time, what do? You go into a crisis mode, right? So there's no really time to sit there and think about what you could have done ahead of time to prepare for this. If you're not quite there yet, or you have some suspicions, this is a good opportunity for you to not go into crisis mode when you have that diagnosis, and also have some great resources at your fingertips through the association and our partnerships. So how do we even prepare? So if you're not in that crisis role, or even if you are, and you can take a deep breath and take a few steps back, this is how we're going to talk about it. We're going to find ways to take control of your role and make sure that you are living well as a caregiver. Remember, if you aren't doing well, who is going to be taking care of your loved one? With help and support, we can make sure that you can take care of your own well-being. A lot of caregivers, we have a statistic around that, I can't remember the number right now, but they actually pass away before they're a person living with dementia because they do not take care of their own personal health. So we got to remember, if we're really concerned about our loved one, we'll be concerned about ourselves. That's not selfishness. That's being smart. So you're going to have a better experience if you can take care of yourself and while you're taking care of the person living with dementia. So a little true or false here. I already answered it. It makes it a little easier in these presentations. When you're a room full of people, you can make people, stare people down, but in this situation, we can't. So someone who helps a person with dementia with everyday tasks like grocery shopping, managing appointments, are they considered a caregiver? Absolutely, they are. These are daily activities that provide emotional and physical support and basically administrative support for you and your loved one in your life. So that is absolutely true. What is it that caregivers do? Well, if you've ever been a stay-at-home mom, or maybe had a stay-at-home mom or dad or grandma in your life, whoever was your caretaker when you were younger, you know that they are all things, right? They're your Uber driver, right? They go and take you to the doctor. They get your medications. They're like a personal assistant almost, if you want to put it that way. Some people want it to be more about that nurturing relationship, and some people need to take the emotion out of the situation for them to perform better in this care partner role. So whatever you have to do to make it work better for you, that is okay. So if you want to make this more of a personal assistant, I've got tasks to do every day that have to be completed to make sure this person is taken care of, or whether you want to be that nurturing role in that relationship and making sure you're taking care of like a mother or a grandmother or a father, either way, whatever works for you. But these are the main things that we're talking about. Those everyday tasks that they're going to need help completing throughout the navigation of this journey of the disease with them. So let's look at a few of those statistics I talked about earlier, that 11 million unpaid provide unpaid care. And that means family and friends, not professional staff, not facilities. This is people who are not trained, people who are just helping their loved ones through this journey that don't have that expertise. And over 6 million, actually, we just updated this. It's over 7 million now. We did our facts and figures in March, and it is over 7 million Americans living with Alzheimer's. I'm going to specify that data. It really means Alzheimer's. I know we talk about dementia and Alzheimer's, dementia being that umbrella term, and Alzheimer's falling underneath as the most diagnosed of all the dementias. So when we say living, 7 million people living with Alzheimer's, that is Alzheimer's is the form of dementia. That's not counting frontal temporal. It's not counting Lewy bodies. It's not counting any of the other 100 or more types of dementias that there are. So that's just 7 million people in America living with Alzheimer's disease. So we're going to talk about families can have different roles, and some can even help from far away. So some family members are right there. They're the direct care partner for their family member, and they're doing more of that on-hands work with their family member. Other care partners, and they still are a caregiver, we still consider them that, are at a distance. And what they can do is kind of help manage those other things in the background, right? Maybe they're the one that's going to take over the financial part of taking care of everything, making sure the bills get paid and everything like that in the background. So maybe that's the part they're taking on because they're at a distance and they can't do the direct hands-on caregiving, but they're still a caregiver, and they're still part of this team. And so I think you can see over here a statistic that and that 64% say caregiving is stressful. Obviously, I mean, I think anybody who's ever been a caregiver at any part in life, whether it's temporary or not, can tell you that it is a stressful situation. But 92% say it is very rewarding. And I think being that catch-all for your person, seeing that smile on their face, making sure that they're really taken care of. Maybe they took care of you, and now it's your turn to take care of them, and you really love that. And those are the moments you can really cherish. And I think that's why that 92% is there, is because if we're taking care of somebody, we're doing it because we truly care for them. So changes that caregivers may experience. I think this is maybe some of you might be here for hearing this part of the presentation. So you're going to be taking on new roles. So your perception is going to have to change of yourself and of the person that you are taking care of. Your relationship is going to change as well. So if you're a spouse, you're going to see some changes in how that relationship is going to be handled. And of course, it's a touchy subject, a kind of awkward subject, but the intimacy, especially in those partnership relationships and marriage relationships, is going to change as well. So taking on new roles. So you're going to have to take on some different tasks because as this disease progresses, their cognitive abilities are going to decline. And so I'll say this up front, and please don't take it as me being disrespectful at any point. But for those of you who may had children in your life, young children, toddlers in your life, this is kind of that new perspective that you may have to take on when you're dealing with somebody with dementia. Again, it's not disrespectful. It's just kind of scientific, is that toddlers in your life, what are they doing? Their brains are growing and expanding, and they're pulling all this information on, and they're learning, right? Their brain is growing. And unfortunately, with this disease, the brain of somebody with dementia is declining. It's going the opposite direction of our toddlers. And so at some point, that activity crosses. So person with Alzheimer's is going this way, and toddlers are going this way. And I say that because sometimes you might find yourself using some of the skill sets and communication skills that you've built up to talk to the younger people in your life, to talk to the person in your life with dementia. And it may feel a little awkward, it may feel a little offset for you, but it is actually a good thing because a lot of people already have those skill sets. So you may have not been formally trained in this, but you do have some of those abilities to communicate with your person. And so you may have to take on that new role with them. I'm not talking about talking down to them or anything like that. I am saying be respectful, but some of the behaviors you can see can benefit from some of those communication skills that you would have with younger people in your life, like breaking down sentences to more simpler statements, simpler choices, and simpler verbs and nouns and pronouns. So things that are easier for them to understand. And so what your new role could do, it depends on where they are in this disease. So early stages, they're still very much participating in life. So you can pretty much continue things pretty normally with them. They may have to have some reminders here and there. They may not be able to do certain tasks, may become really hard for them. So it may be something that comes onto your plate, but it's everything from household chores to more serious responsibilities, like making sure they're taking their medications, making sure that they're getting to their doctors, making sure that they're doing their hygiene. So more serious things can happen along. So what can you do with this change? First things first, if someone is able to have this conversation with you, the person who's diagnosed, and they understand what's happening, please have this conversation with them from the beginning. Understand what they want from you, what they might need from you, and how they want to experience this journey. Down the road, that may change. Down the road, they may not remember what they said. But I always think as a care partner, it's so very important that you understand their wishes so you can do your best to follow those wishes. And that can help the stress level and guilt level you may feel for making decisions for somebody in your life like that. So if you know that they wanted something a certain way at the very beginning of this disease and they communicated that to you, then you can try to do that as long as possible. Like I said, further into the disease, it may not be possible for you to honor their request, but I'm sure you will find a way to do the most you can, the best you can. And that's all we ever ask. So relationship changes. What's going to happen there? You may find that you don't have as much time for your families and friends around you. They may pull away. They may be afraid to say something or do something wrong. It may be hard for them to accept. Everybody deals with this process their own way. And it's okay to let them do that, but you need to be upfront about that. And we'll talk about that later when we talk about your care team surrounding you. But we want to make sure that everybody understands what's happening. So some people deal with this journey by jumping in gung-ho. What can I do to help? Give me all the tasks. I have to do something because if I don't do something, then I'm not helping. It's their way to kind of fight this disease. How can I help? And sometimes that's really great. And sometimes that's really hard because sometimes that makes more work for you as the direct care partner, right? So we'll talk about this again, but being direct about what your needs are is very important. Other people are going to pull away because they're going to be afraid of the situation. Maybe they don't want to see the changes in this person. Maybe they want to kind of disconnect from this altogether. And you really aren't going to be able to change their perspective on that. And so I'd say, let them do what they need to do to get through this. And if they come around, they come around. If they don't, you have to spend time doing the things that you can do and that you can control. So what can we do? Reach out to them and let them know that you appreciate their friendship and their support. Think about having an intimate conversation with the people that are going to be the most important in your life. So have that discussion with them. If the person's still in the early stages and can be a part of that discussion, that is even better. But introduce them and educate them on what's going to happen. Say, hey, listen, they're in the early stages, so you're not going to see a lot of changes right now. They may have some memory issues. They may forget a few things or name or replace every once in a while, but they're still very much with us. So that's okay. In the middle and late stages, you may have to say, hey, they're not understanding bigger words. You have to use smaller words. They're not understanding words very well at all. So please use hand signals and things to communicate with them better. All those things you can do to help people better prepare for being a part of your life. So here we are, intimacy. I know it's a little awkward, but we need to talk about it. Not only can the physical things change, but the emotional closeness can change. And as this disease progresses, you may not have the same emotional connection or physical connection with this person because your perception of them is going to change. And you have to change your perception of them with your relationship so that you can do what you have to do to take care of them. So what that may look like is changing things from a non-sexual touching, like holding hands or hugging, doing an activity that you both enjoy, listening to music, going for a walk, talking about your memories, looking at a photo album, helping them put lotion on their skin. That's a very nice activity that you can do to connect with them on a certain level. But these are things that are going to have to change. I had a wife in one of my classes, and she told me, I'm getting so frustrated with my husband. He's starting to show some signs. He's not the same person. I find myself getting angry and frustrated with him. And I know I can't do that because it's not him. It's not his fault. And she very much understands that. And I said, it is very frustrating and it can make you angry if you don't change your perception of this person. They're no longer that person that you've always known all your life. So the way you communicated with them before, maybe you're a very direct relationship with each other. And all you have to do as a wife and go, honey, go take out the trash. And he's right on it, right then and there. He knows you want it done when you say you want it done, and that's fine. And he loves that you communicate so directly with what you want from him. Now, as his brain is being changed by this disease, that kind of direct communication could get resistance back, and it could start arguments or tension between the two of you because his brain is changing and this disease is changing it. So it's not him, it's the disease that's changing his brain. And now how you have formerly communicated with him is no longer going to be his preference. So you have to kind of be flexible in how you're going to communicate to people, both on an emotional and a physical level.
When I think about caregiving for my dad, who's been living with Alzheimer's disease for 13 years, my expectation is not that my dad is going to remember my birthday or know how old I am. But I'm pretty confident that if I show up at his place in his memory care assisted living with some cake, light a candle, and tell him, Dad, today is my birthday, he's gonna smile, give me a hug, and want to enjoy some cake with me. And so that gives me a glimpse into that love and that connection that's still there between us as father and daughter. I've had to realign my expectations, but that has allowed me to be more present and available for these happy and connective moments between us.
So she's talking about those connective moments, and how we're going to do that is we're going to talk about being a person-centered approach to care. So what is it? So it's care that focuses on the individual and their needs. We're going to talk about what their likes are, what their dislikes are, what their capabilities and abilities are so that we can provide them the best of care. What are those benefits when we're talking about the people who are living with dementia? So we know that behavior is a form of communication, and we know that there are behaviors that come from this disease, and there's some that are very stigmatized, but I'm going to tell you, this disease has some generalities across the board, but it can be just as individual as the person who has the disease. So movies and TV sometimes can reflect what that looks like, but honestly, you have to kind of start learning about your person and how they react and how this disease is affecting them as you go along through your journey, and correct and accommodate as you go along. But this can help you with those behaviors and give you some skill sets and foundations to communicate better with them, to listen better, to see them better, to hear them better, so that you can communicate with them better and deal with those behaviors, which may help negate the need for medications to treat some of these symptoms. They're going to be less bored. We talk about sundowning and how sometimes that can be a little anxiety for people in the afternoon when the sun goes down, and they want to clean everything and wipe everything down, or they feel like they need to go somewhere, move somewhere. If we take this approach, we're going to find things that are going to help alleviate some of that stuff. We're going to lower their agitation levels, and we're going to increase their happiness and well-being. Them feeling safe and comfortable with you and their environment is going to negate a lot of issues down the line. What are the benefits for you as a caregiver, right? Why should I have to take this approach and learn about it and implement it? That sounds like a lot of work, Brooke. Well, it's going to give you some confidence. We want, as an association, to give you the skills, to give you the education and the information, to give you the power as the caregiver to take these matters into your own hands and have the confidence that you can address these behaviors and the communication with your loved one properly. So that's going to increase your satisfaction of being a caregiver. You're going to get more of those smiles and more of those connective moments, more and less of those agitated moments. It's going to improve your relationship with the person with the disease. Again, that wife was feeling frustrated and angry because she wasn't quite changing her perception yet. And so we want to make sure that we can do that so we can have a better relationship with them. And it's going to give you a better quality of life for you and your person in care. Again, you have to take care of yourself as a caregiver so that you can continue to be that person for your loved one. So what are the strategies of person-centered approach care? 1, we're going to use your knowledge of your person. How long have you known them? What are their little quirks and things that they do? These little things are going to come in handy when you're dealing with this person down the road throughout this journey. We're going to make sure that, like she said, we're going to connect in those moments, even if they're not what we thought we would be doing, we're going to connect in those moments to them. We're going to help them do meaningful activities, and we're going to participate with them because, again, that's helping us connect to them. We're going to focus on a relationship with this person. That relationship, remember, may change how we relate to them, how our perception of them are, but it doesn't mean that we're going to stop having that relationship. And we're going to create that supportive environment, that safe, comfortable environment for them so that it leaves less frustration for all of us. The strategy number 1 is use your knowledge of the person. So you might know them better than anyone, and you may need to learn even more about them and how to provide that care for them. So what are we going to look at when we're talking about that? What makes them unique? What are their beliefs, their interests? This is going to come in handy throughout this disease. So when we're talking about communicating with them, if you know them best, and I talked about kind of putting our choices down, using simple things to communicate with them. So you know them best. You know that there's going to be, they like turkey sandwiches and like ham sandwiches. So when you go to tell them we're having sandwiches for dinner, do you want turkey or ham? You know that they like turkey or ham. They could eat either one, but you've limited their choices to 2 choices. You're still giving them a choice. You're still having them participate in what's happening, but you're limited it so they don't feel like there's infinite answers there. And so you know what they like, you know what they dislike. So that's going to be helpful to you in this situation. Keep in their mind that the hobbies and the interests may change over time, but if they've been really connected to something in their life, you can utilize that throughout this journey to help them through that. So you make sure in the beginning stages, if they were always somebody who was musical, to have them continue that musical, that playing the piano or the guitar, whatever that looks like for them. And as they progress in the disease, maybe they can't play all the notes or all the songs as much as, but you still want to participate. So maybe instead of having them play, maybe you have someone play for them, and that still brings in that hobby. Maybe they were a woodworker, and maybe they will not be able to do all the nailing and the gluing to do the woodwork, but maybe even in the later stages, this is still an activity that might connect to them of who the person that they are or who they used to be. That's still very much back in their mind somewhere there. We could put a board in front of them and give them a piece of sandpaper and have them sand down the wood. It's still an activity connected to something that used to be a very big interest of theirs. So that's a way they can still stay connected to what they like, and they can still stay connected to something that they used to know. And so very important in keeping them engaged. And then talk to others who are close to this individual. If you don't know them as well, get the, I guess what they're saying, get the tea now, get the tea about that person and use that to the best of your ability. So we're going to connect in that moment as our number 2. We want to make sure that this will get them to understand that we're connecting them, we're hearing them, we're understanding them, and it's going to give you the right support in this moment. What does that look like? Seeing the world through their eyes, that can help you understand what's happening behind what behavior might be showing. And so what this may look like is for the most of this journey, they've been happy to let you drive them everywhere, to the store, to their friend's house, to activities, to the doctor's office. They don't care. They just like the ride. They don't care that you're driving. But all of a sudden, they start reacting different. They're mad, they're upset, they're agitated about getting in the car and going places. And you're like, oh, what is going on here? So think about what the feelings are behind that behavior. And you can do that by saying, what has happened recently? You have to be a little bit of a detective here. So hone your detective skills, watch some more CSI or something like that. But you have to hone your detective skills and say, what has recently happened that may make them agitated about getting in the car and traveling? Maybe it's just recently that you've actually physically sold their car, taken their keys, and taken their driver's license. So before, it didn't really matter if they had all that stuff because they were happy to ride with you. But now that it is no longer a choice, they are experiencing that loss of independence and freedom behind having the option to drive themselves. And so you may have to see that agitation as a behavior that's communicating their feelings behind what has recently happened in their life. So seeing their individual reality, we always talk about this in the association. If they're safe, you are safe, and everyone around you is safe, sometimes you just let them be where they are. And that reality may be very different than the actual reality that has happened. They may think it is 1960 and they are getting ready to go to prom and dance the night away to Elvis. And that is perfectly okay. One of the keys to being a care partner with this disease is you're going to have some flexibility. That may not have been the plan that you plan to do today, but this may be an excellent opportunity for you to connect with him or them in that reality that they are currently in. So maybe you go and do their hair. Maybe you get their nice dress out or their nice suit out. Maybe you do your hair and you put a nice dress on. And then you say, hey, Alexa, play Elvis. And you guys have a little dance in the living room. And as the daughter said before, it's your opportunity to connect with them in a different way and have that positive experience throughout this disease, especially a disease that causes so much heartache. So as the disease progresses, you want to focus on those feelings and not the facts. You know that it is not 1960. We do know that Elvis is not alive. But we don't have to focus on that right now. We just have to focus on the fact that they are excited and happy and they think they're going to do something fun, and you can join in on that. But if the topic bothers them or upsets them, we do need to change courses. So this is where it might get difficult for some people. It's going to be the emotional part. Again, please remember that this is a disease and this is nothing personal towards you, even though you may feel that way. So today for them, you say, hey, Mom, do you want your morning coffee? And she looks at you and go, I'm not your mother. Don't call me Mom. I'm not your mom. It's very upsetting for her, right? She's very agitated about the fact that you're calling her mom. That can be heartbreaking for you as a daughter or a son or a loved one, because that's how you connect to them, right? So instead of pressing on with that title that is obviously upsetting them, and it may be upsetting them because they know that there's a connection there, but they don't know what the connection is to you, and that's upsetting enough. But then to be told that they're not remembering that mother-child connection can be more upsetting for them. So again, looking at those feelings behind what could be happening there, just switch to say, oh, I'm sorry, do I need to call you Paula today? Like, I'm sorry, Paula, or just call her by her name. Do you mind if I call you Paula? You know, use those strategies to be able to communicate. And for that day, that hour, even with this disease you don't know, she could be Paula. And that's going to help her deal with what's happening until she's ready to come back around. And that can make your day less frustrating as a care partner, because every time you call her Mom, she's going to get agitated. So how can we, number 3, help make activities meaningful? Make those interactions important for them and you as the care partner. We want to have meaning and purpose. Again, if they're a woodworker, let's have purpose behind it. I mean, maybe it's not purposeful for them to sand a piece of scrap wood, but for them, it reminds them of who they were and what they did and what they loved. And it's a way for you to remember all those memories about all the things that your dad made for you over the years in his woodworking shop. So it's a great way to connect on multiple levels. You do have to take in their abilities. So throughout this disease, you're going to have to communicate and make accommodations for them as this disease progresses. So it may look like they can still do the dishes and do more complicated tasks at the very beginning, but as this disease progresses, it may not be that they can continue to wash dishes in the sink, maybe because there may be it's dangerous because they don't remember that you shouldn't put knives in the bottom of the sink that you can't see because you might slice your hand. So those kind of things may become difficult tasks for them, but maybe folding towels becomes an easier task down the road. And that's an easy activity for them to do. And it's helpful in the long run for you because you have somebody to help you do some of that work around the house. Know that we want to make sure that we're giving them choices. So maybe there's 2 tasks. Hey, Mom, you could really help me today. Do you want to either help me by putting the coffee cups up, or do you want to help me by folding the dish towels and putting them away? Give them some choices of what they can do to help you so that they feel respected and successful in what they're doing. We also want to make sure that they're feeling joy and comfort even as this disease progresses. We want to make sure that their environment is conducive to that. You also, again, here we go with this, go with the flow of the flexibility. You don't need to plan every activity every single day for every minute and every hour. Sometimes you'll have to just go with the flow because unfortunately, every day that you wake up with your person may be a different kind of day than it was the day before. So you're going to have to allow for flow and flexibility as you move through each and every day. Number 4, focus on a supportive relationship. Person-centered means putting a person before the task. Here's that lovely word I keep saying, flexibility. So you may have plans for the day and they may have different plans. Again, we kind of have to go back again to that relationship with the young people in your life. How many times have you had to change your activities for the day because that young person was overly tired or overly hungry? Those kind of things are going to happen here too. So think about choice and flexibility instead of how much you can get done. Pay attention to what's happening with that person in certain moments and make sure that you're encouraging that independence. Do the activities with them rather than for them. Again, if you and your toddler are building towers, maybe they're building a tower and you're watching and you go, oh, what if you put that up there and then that do they always like that? Do they sometimes just knock the whole tower over because rude, how dare you tell me in toddler speak, right? So in this situation, it might be best if you both have your tower, or maybe in the situation with somebody with dementia, you both have a set of towels to fold. And so you can do them together. And that way you're modeling what to do versus telling them what to do or doing it for them. So they may start folding towels and they may not have the cognitive ability at that moment to fold them properly. So they may be folding them in a triangle shape. And that may be frustrating for them, but instead of doing it for them or telling them how to do it, you can just start folding your own towels and doing it into a square, and they will probably follow what you're doing. So it helps you connect in a way and helps you still be supportive of their independence instead of just doing things for them.
Caregiving can be difficult, but each day presents us with opportunities and challenges. So it's really important to celebrate those small wins, like providing just the right amount of support to have somebody successfully get dressed by themselves or brush their teeth or even set the table for dinner. Everything that happens throughout the day can be considered an activity. Little things like setting the table or going for a walk and talking about family, or even spontaneously dancing to some music are all things that happen throughout the day and time well spent.
So number 5, create a supportive environment that helps a person living with dementia be successful and is independent for as long as possible. This is going to really help you be the best caregiver, and you have a good relationship with them, and you also get the opportunities to have that care for yourself and that time for yourself. So what does that look like? Talk with the person about what supportive environment feels like to them. There are going to be some times where they can't answer you, but always ask. You never know kind of where they might be to be able to give you that feedback. All right, tell me what you want to know, Dad. Why are you frustrated? Tell me what's bothering you. And if they can communicate back to you what's happening for them, that is going to be super helpful for them and super helpful for you. And then they can ask you questions like, well, where's my car? And maybe you have a really open conversation with them, and that is what works for you and them in this time is, you remember, Dad, you moved in with us because you're having some memory problems, and we sold your car because you can no longer drive because it's not safe for you or other people. And so having that very open but calm conversation about that, what seems to be bothering them by the question that they asked you, is perfectly okay. Sometimes, I will say in our behaviors, we do talk about redirecting a conversation if it looks like it's going to agitate your person. So sometimes if you'd said, Dad, we sold your car, Dad's going to be like, you did what? And it may not be having a calm conversation about the truth with him about what's happening may not be what he needs to hear at that moment or that time. So you're going to have to, know your person and know how they want to be communicated with. Think about changes in your home that increase your safety. Super, super important. 60% of people with dementia will wander. So we want to do everything we can to keep this from happening, but we are also going to understand that it could happen. And if it does, what is our game plan? So that's, I think, the first step when you're talking about safety in the home. We want to try to stop it, but then if we don't, what is our game plan? Things you can do around your home for safety: put gates up around stairs. I know, again, it comes back to the working with toddlers in your home, but gates on your stairs so they don't fall down, because sometimes their perception of levels is no longer there because of this disease. Putting the child-proof locks on your cabinets that have knives or sharp things in them or chemicals that they may get a hold of, that safety. Putting a lock at the top of the door, so they probably won't think to look up to unlock the door, but you can also put the little knob things on. I hate those things. I can't get out of them myself. They push down, turn to get out the door. Also, people don't think about this, but taking things away from your exits in your house that cue them or trigger them to go. So keys, hats, coats, pocketbooks, all those things. Again, it may make your life a little bit more complicated as a care partner, but if it keeps them from wanting to be triggered to go out of the front door, their safety is important at that matter. So suggest activities they like. If they always loved going to the local art museum, suggest that activity and see if they respond positively to it, and take them out for a day and have them enjoy the art at the local museum. We want to make sure we're going to keep favorite items around them. That's going to make them feel comfortable, like it's their environment. So if you're moving them from their home to your home, it's very tempting to get rid of all that old furniture and bedding and get them all new sparkly stuff. Or maybe you really love your beach cottage decor in your guest room that they're moving into. But it's really going to make them feel more comfortable if they have familiar things in their space. And so bringing their antique dressers and bringing their old comforters, maybe a new mattress is good, but bringing those things, their rocking chair or their sitting chair, and putting them in their space helps them and soothes them and keeps them more comfortable and makes them feel like they're still at home. And that can be very calming for them and a good atmosphere, soothing atmosphere for them. Take care of yourself by asking for help. Please don't be abashed to ask for help when you need it. In fact, start thinking about who's going to be your support system, and that's going to help you as well. So take a break. Even if a break looks like, okay, they're sitting and watching the TV. I've got probably about 15 minutes to take some deep breaths, or I got 15 minutes just to sit and calm and meditate or read a passage out of my Bible, whatever makes you calm. Take those moments when you get them. So now here's one of our important parts too, building a support team. Importance of a support team, who we need to include, and the tips for developing your team. So you're going to get more done when you have help, for the most part. Again, that pushy person that's always like, let me help, maybe. But if you get to dictate this, you're the primary caregiver, your rules, right? So make sure you do that from the beginning, but that's going to help you get more done. You're going to stay active and you're going to find more time to take care of yourself. Again, even if it's somebody just coming over and they're like, oh, let me come over and clean your house. I clean my house. I know how I like things. I know how it's done. They think they're helping you by coming over and doing the tasks for you. But what really probably would help you instead is having them sit with your person during their maybe normal hour nap time so that you can go and do the task that you're not getting done, like cleaning or vacuuming or doing the laundry, putting new fresh bedding on their bed so they have a nice fresh bed at the night. Some people think that taking those tasks off your plate is what's going to be helpful, and sometimes it's not. So again, dictate what you want. We want to make sure we're lowering your stress by having people available. Think about the emergency situation. What if you fall and you hurt yourself and you have to go to the emergency room, and then you have to be on crutches for weeks? Who's your backup? If you don't build a support team around you, who is your backup and who's going to help you take care of your loved one in that situation? So think about those potential situations where you won't be able to do the caretaking. So think about who you can trust and rely on. Make sure that you update your care team about how this disease is going to progress so that they're prepared to do it on all the levels. We're also going to talk about who that team includes: family members, close friends, neighbors. Get to know your neighbors, please, because they can, maybe the kid down the road can do your mowing and lawn work for you so that that's not something on your plate. Your neighbors may have doorbell cameras or security systems so that if your loved one does get out of the house, they can help track which direction they went. You can let them know that you're experiencing somebody in your home with dementia, and if you see them out and about without another person with them, to please immediately contact you, because that is a dangerous situation. So it can help mitigate some very dangerous situations and be helpful to you as well. Part of that outside team is your neurologists, your counselors, your specialists, volunteers, your local agency on aging, which I think is the Jefferson Board of Aging, JABA, and the Charlottesville area, your faith community, your church family. All these people can help you and be a part of your support system in different ways. So what help do you need? Make a list. If you're a list person, make a list of what help you need that other people can help you do. Again, you're making the dictation. You're telling them what you need. Don't let them tell you, oh, I'm going to bring you 6 frozen dinners. My freezer can't hold 6 frozen full meals. So that creates a problem for me, not a helpful thing for me. So make sure you're telling them what you need. Talk to them and make sure they want to be on your team and they can be on your team. Don't take it personally if they can't help. Because I had this conversation with my mom. I have degenerative joint disease in my spine. I said, Mom, please, when you're thinking about your plans for your will and your wishes, make sure that you are thinking about the possibility that even though I physically will want to be able to help you and Dad as you age, I actually may physically not be able to do it because of my own health issues. So please be thoughtful of that as you're making your plans of whether we need to bring professional help in and what that looks like and how we get that done. So, and she was very receptive to that. She understands where I'm coming from. So make sure that not only that you need the help and how that you need the help, but make sure they can provide the help to you. So who are the 2 people you want to team? just in your mind, if you want to right now, write it down. 2 people that come to your mind. Usually the 2 people that come right up front are the people that are going to be a part of your support team. And then again, thinking about what they need. Are they your emotional? Are they that transportation? Are they doing your medications? They just care duties. Maybe they're just sitting with your loved one while you do things. What are they? So we're going to move into you and how you take care of yourself. Dementia caregivers are less likely to experience anxiety, depression than others. I'm going to go with false. I was right. Good for me. Caregivers of people living with dementia are more likely to experience all of these things. And they are also more likely to experience financial and physical difficulties because of this disease. All of the above, because you're not taking care of yourself, you're ignoring your own health, your own well-being, your own mental status, your own medications, they get left behind. And these are all the things that we are the warning signs of our caregiver stress. We talk about the warning signs of dementia. This is the warning signs of your caregiver stress. And we want to make sure we're paying attention that we're not marking too many of these off at one time. All of these things can lead to bad things for you and your loved one. So again, if something happens to you, who is taking care of your loved one? So if we take care of ourselves on all of these levels, even though it is really hard and it is easier said than done, I understand, we need to take care of ourselves so that we can take care of them. Think about it this way too. It's not just like if you broke an ankle or something like that and you couldn't take care of them. Think about it as putting them in danger as well. If you're not getting enough sleep, proper sleep, or you're having lack of focus, what if you as their care partner, unknowingly, you're just tired and overwhelmed, give them their medication, and then because you have a lack of focus, because you're so exhausted, forgot that you did that, and then gave them a double dose of their medication because you weren't sure, right? Now, you're not taking care of yourself relates to them not getting taken care of well either. And again, we're not blaming or judging anybody for that, but I want you to see what the risks are if you don't take care of yourself. So blurred vision, stomach, high blood pressure, changes in your appetite, sleepiness, all things that are problems and stress related to taking care of people. Find relaxation techniques. They're showing yoga. Yoga may not be your thing, and that's okay. A lot of people are going to suggest a lot of things to you about how you need to relax. You can listen to them if you want to. You can try out new things if you want to, but please listen to what works best for you. Because sometimes I like the white noise or the green noise or the pink. They have all the colors now and the noises. And I like to put those in headphones and just kind of listen to that noise and really block out all my thoughts and stuff. And that really helps relax me. I also love to just dive into a good book series where I can escape the reality of what's happening or the stressful things that may be coming around me. I can escape for a little bit and see, well, at least I'm not getting chased by a dragon. That's not happening. So you can get it and escape, but do what works, whether it's breathing exercises or meditation, or whether it's that book or movie, even if it's 15 minutes, even if it's 5 minutes of you doing deep breathing, take what time you can, because it is so important for you to get those moments of respite for yourself. And make sure that if you are continuing to see some of these signs that I'm talking about, to please see your doctor. Make sure your doctor knows that you are a caregiver for somebody with dementia, please. Because how they treat you, how they work with you, medications they may give you could change according to what they learn about you. And being a caregiver is a health issue. We see that, right? So maybe your blood pressure is through the roof. Maybe you've always had fabulous blood pressure, but caregiving is stressing you and it's making your blood pressure go up. So maybe temporarily your doctor and you need to have a conversation about putting you on medication for your blood pressure temporarily to help you through this time. That could be understandable. And if they know that this is a temporary situation, where it may not be a long haul situation for this medication for you, but you need it because we can't have our blood pressure going through the roof every day. Have that conversation. Involve your doctor in what you are doing as a care partner. So be realistic. Enjoy those positive, enjoy those smiles they give you, enjoy the I love yous when they come, enjoy the thank yous when they happen, enjoy those moments. But be realistic that sometimes there's going to be really hard days. And this is what I consider a three-part process for you as a care partner. The diagnosis, when they leave you cognitively, and when they leave you physically. So this is a long grieving journey for you as a care partner, and you need to acknowledge those emotions and those feelings so that you don't get them all blocked up. Know that you are doing your best, please. I had a gentleman one time in one of my programs that came in front of 300 people and said, my wife has this disease and I've been doing it all wrong, and I know that now listening to you. You're not doing it all wrong. You are doing the best that you can with what you have. And that's all that anyone, including your loved one, could ever ask of you. So please understand you are doing your best. I think there's a broken record. Take care of your health. Take a break. Get help when needed. So what that looks like for you and your people is different.
The advice I would have for others about caregiving is to be kind to yourself, be gentle to yourself, allow yourself to make some errors. Don't judge yourself so hard. Take good care of yourself, eat well, exercise, interact with people outside of the household. Do things that are just for you. Go out to eat sometimes. Go out to eat with a friend or maybe alone. But remember that you have to be the best you in order to take care of your loved one. So it is very, very important that you take care of yourself.
Hey, that's another caregiver. It wasn't me just telling you that. So there is this take-home activity. I will give this to Sator so she can send it out to the emails that you've provided. It's just a little take-home activity that you can do to help remind you about what we talked about today, but also give you a little think about that you can have. I'm gonna roll through these a little bit because I'm taking too much time and I want you to be able to have some questions. So these are our resources as the association. These are things that we can help you with. Number one, since we're running low on time, 24/7 helpline, 24/7, 365 days a year, 200 languages spoken, TTY services, and chat with master level clinicians who are trained and educated to answer your questions and help you do care consultations about this disease. So whether it's a behavior you don't know how to deal with, whether it's a transition you need to make from one place to another, they're there to listen to you at any time of the day that you need them. So when it's convenient for you, not for us. We have our alz.org, our support groups that are virtual or in person, our community resource finder, which is like an online zip code finder for services that relate to dementia. We have our navigator, which is kind of like making your own action plan. You can go to these activities and punch through the quiz, and then it'll give you a whole page about that and about that certain thing like driving or safety or care. And then you can walk through that and make your own plan. ALZ Connected online message board for people who are caregiving, but also those living with the early stages of dementia. We also have our education programs. Maybe Sator will invite me back to do some of the additional one of these empowered caregiver programs if you let her know that you appreciated and liked it. So I'm happy to come back and do some more information for you if you would like me to. I'm going to stop sharing my screen. And hopefully we got like a minute. But if you guys don't mind staying over a little bit, I'm happy to answer questions.
Yeah, sure. If anybody's fine with staying over, we can, keep you on to get questions in. We're sorry we went over a little bit, but we're a few minutes behind starting, so it's fine with me. If anyone has questions, feel free. Let me see. We did have folks muted. Let me unmute. I can do them all at the same time.
And again, if you don't mind doing that form I just put in the chat, I'd really appreciate that to let us know who we're reaching and where we're reaching. Just your name and your zip code is all we need. Your email is optional. If you want me to send you more information about this, I'm happy to do that, but it is optional. You don't have to give me anything but your name and your zip code. And that, again, just helps us to know how many people we're helping and where we're helping them at.
I was trying to unmute, but just unmute your phone if you need to speak because you are on mute. I was trying to unmute them, but I may not be able to because I don't think she made me a co-host. I'm not sure.
You can type in the text box of your question. You don't want if you don't
Yeah.
want to mute, you can type in the text box. Or please, my email address is in there. I'll redo it in case you didn't see it.
Yeah, you should be able to unmute yourself.
Okay. So it's begill@alz.org is my email address. And then my number is 540-632-0973. And you can reach out to me if you want to ask me something directly and not in front of everybody.
Yeah. And I'll send out we will send the information out that you mentioned, the forms and the contact, all the resource contacts for Alzheimer's, because that's helpful information for everyone. But we'll send that out in a mass email for all the people who signed up for the Zoom. We had a lot of people sign up, but I think a lot of people sign up, but then they aren't able to come, so they will be able to see the recording, and then they can still get the information that we're talking about.
Absolutely.
Yeah.
Brooke, I think that there's Bob has a question, and then I received a question in the chat as well. But Bob, do you want to ask your question?
Yeah, I just wanted to ask Brooke to go over contact information again. You gave your email and your phone number.
Sure. Again, my email is begill@alz.org. And then my phone number is 540-632-0973.
Thank you.
Absolutely. And if you lose that, you can call our helpline and they can connect you to me. So don't worry about it if you lose that information. Our helpline on our website, always available.
And then Brooke, there was a question about what about moving to a facility, and also what about a licensed nurse, licensed home health care? Do you have any thoughts or anything that you would like to share about those services?
You can definitely thinking about a facility for your loved one. I think a lot of people feel bad about maybe possibly putting them into a memory care facility, but I'm going to tell you that sometimes it's the best thing you can do for them. I'm not saying either way, whatever is going to work best for you is what you need to do. But it's a consideration because I had someone tell me that they did it and they finally got to become a wife again instead of the care partner. The facility took care of being that care partner and that professional care for their person and taking care of those needs. And they just got to come in and visit them every single day and be with them as much as they wanted to, but they got to be a wife again from their perspective instead of taking care of those other things. So home health can also be helpful as far as your local agency on aging can probably help you with finding some home health that they've checked into to make sure it's secure. But they can be helpful to give you that respite that you need to be able to step away for a couple of hours during the day and also help you with those tasks that maybe you can't physically do yourself. So always looking into those things, but use trusted resources like your local agency on aging, like Martha Jefferson. I'm sure they have some referrals that could send you to as well. So make sure you're using trusted resources if you're bringing someone into your home. Any other questions I can answer for you?
Not as many questions this time.
I know. Maybe I covered a lot.
Yeah, that maybe you did answer. You did cover a lot of information, which was great. But yeah, maybe we could talk more about doing something maybe in person if possible, or I don't know, you talked about kind of like, a more interactive session about some of the specifics, because we do get a lot of interest in these presentations that you do regarding Alzheimer's. I think everyone, probably almost everyone, can name someone that either had dementia or Alzheimer's or is, dealing with it right now with a family member. It has become very common, unfortunately.
Absolutely.
But it's good information for everyone. So
Happy to see you.
we might be able to set something else up, or in a different setting, but anyway, we'll talk more about that. But I do thank you for your time and presenting a great presentation as usual. And we will continue to talk and bring more education and support out to the community as needed. Yeah.
Absolutely. And I would say if you're a care partner, it's new to me. I don't think it's new to this space, but I would just suggest looking into the Montessori approach to dementia care. It's newer to me. I just got my certification in it through the National Dementia Certified Practitioners. And it's a little bit newer to me. I think it's been in the field for a little while, but it might be an approach that some of you may be interested in when you're talking about being a care partner. And I kind of mentioned that in my behaviors program that I do, but if you want to take a look at that, it may be something that you'd be interested in looking up and seeing if that would work for you.
Yeah, that sounds good. My contact information was in the chat too. So if anybody wanted to reach out to me for more information or something that they needed from us, or more information about our chronic disease and healthy living program, please, don't hesitate to email or give me a call. So thanks again, Brooke, and we'll let everybody go. So we'll be in touch.
Thank you, everyone. Appreciate your
All right.
time.
Thank you.
Thank you.